All right, many of you have noticed COVID face or mask knee. It's become a common occurrence over the last year or so. So how do you cancel that? What should we be doing that we aren't doing right now? Joining us now, dermatologist, skincare researcher, Dusan Sajic. Thank you so much for doing it. We've been wearing these for like a year now, and at the end of the day, you feel irritation. You feel kind of moisture, you feel dry. There's a whole bunch of stuff going on. What can we do to save our faces?
Excellent question. So there's lots we can do. First is, you're absolutely right. We're not as humans designed to have this thing on our faces. So it changes a lot of our skin structure. So our skin cells become, the barrier gets compromised. The beneficial bacteria that live become compromised on our skin. So we try and get that back. So a lot of the things we can do is wearing a proper mask, for one example. That's what I would start with. And if we're wearing a mask that's a little bit less irritating, like a cotton mask, you want to make sure you treat it just like underwear. Change it frequently, get something with breathable material, and make sure it's washed and clean. And then secondly, I think really talking to your dermatologist, finding out, I have a lot of patients coming to my clinic and sort of saying, well, which one of these do I use? So it's really about simplifying, because in an attempt to actually fix things, we could be making things worse.
Yeah, there's so many products out there that you can get. I don't know what I'm doing. My wife thankfully helps me. But before you just pour a bunch of product on your face, what should you look for? What should you try to avoid?
Absolutely. So you don't want anything irritating, anything with fragrance, anything that has colors in it, because that'll just compromise your skin even more. So bland, gentle stuff. And then I have what I call my skin pillars. Okay, so that's sunscreen. That's probably number 1, 2, and 3. But then number 2 is retinol and vitamin C, like antioxidants. So those are my traditional ones. But if you're having severe mask knee, those things, because they're acids, can actually make your face even worse. And we see that all the time. Patients are coming in, they're like, I'm using your pillars. What can I do? So it's really about trying to get something more gentle. One of the products we actually did some research on and saw that it fixes the skin, makes the microbiome much more back, is this product called Exactly that we sort of tested in our clinic. And it's got sort of, the reason I really like it is that what I call it's kind of the world's gentlest retinol, because we use it for severe conditions, people that have had burns and stuff, and right after a procedure. So it's really, again, talking to your dermatologist, seeing what you're doing, because things you're generally helping your skin could actually be making it worse.
We know when we leave in the morning, we're going to be wearing our mask likely the entire day, or we're going to be in our houses away from the sun likely the entire day, just staring at a blue screen on Zoom calls like you're doing right now for us. What's the one thing you could do to kind of prepare your face for the rigors of the day?
Excellent question. So I think what we can do is just, like I said, bland. You don't want to be using harsh soaps, for example. Anything that strips your skin, put away your toners for now if you're using your mask. We really need to let our skin breathe, minimize our products on there, and still stick to that sunscreen. And I love that you bring out Zoom. It's one of the things, one of the hidden dangers is that blue light that's coming from the screen is actually making us age faster. It's damaging our DNA. And making our skin just look that much more dull and much more prone to this, even mask knee and other signs of COVID face. So putting a filter on your phone, like even a screen that blocks out the blue light, or wearing sunscreen, even indoors, especially tinted sunscreen, because that's going to block that blue light. And then, like I said, sticking to the pillar, sunscreen, using gentle products, avoiding anything that's harsh, and that'll go a long way.
Yeah, and I think the big thing here is preventative. Don't wait until you have a problem. Do it now so you avoid the problem later on. Thank you for joining us this morning.
Thank you so much.